Aloha and good morning, everyone. Welcome to the COVID-19 care conversation with me, Yanji Denise, and Ryan Kalei-Suji. We've got to tell you right off the bat this morning that we are having a few technical challenges, so please bear with us, but we are doing the best we can. This, of course, is there we go. This is a conversation brought to you by the Hawaii Executive Collaborative, which is a consortium of Hawaii business and civic leaders working to make the islands a better place. Good morning, Ryan.
Good morning, Yanji. Yes, again, we apologize if there seems to be a little bit of a delay. We are trying our best to work. I think one of the challenges with people working from home is there are a lot of people on the network these days and a lot of people doing live videos. There must be some live Zumba classes or something going on right now. So a lot of people on the network, but we're trying our best to work with the limitations, as well as many of you who are finding yourselves working from home in sort of this new reality, a reality that we may find ourselves in for a little bit more. We'll get to some of the headlines, which include the extension of that stay-at-home order by Honolulu Mayor Kirk Caldwell. But first, we'd like to begin each show by, again, encouraging you to share this broadcast, but as well as highlight who we have coming up.
Yeah, and that's right. We have Dr. David Derauf from Kokua, Kalihi Valley. They, of course, are a community health center, and they serve a large population right in the urban core of Honolulu. That they and clinics like them will be essential in the mayor's new testing plan. And we want to talk to him not only about increasing testing, but also about how to protect Hawaii's most vulnerable populations. And that includes the elderly and people who are of low-income backgrounds. We always like to start the day with the count, and this is amazing news, Ryan. Just 2 positive statewide as of noon yesterday, and again the second day in a row 0 on Oahu.
Yeah, we'll continue to see that flattening of the curve, which is really what state and health officials were hoping to do with this sort of all these mandates that are put in place. Just 2 new cases for a total of 586 total positive cases within the state of Hawaii. Of course, we also mentioned yesterday there were also 2 deaths that were added. So any death is 1 death too many, but good to see those numbers continue to go down. The hospitalizations continue to remain stable, and those who have actually been cleared or sort of released from isolation, the way that the health department puts it, continues to go up as well. So good news that of those 437 have been released from that isolation. Another big announcement yesterday, we are hearing from Honolulu Mayor Kirk Caldwell that the stay-at-home order will be extended through the end of May. However, there will be phases in which they will begin releasing and allowing people to do more and more in the community.
Yeah, and one of those big things is opening the parks. I know a lot of people have been going a little stir crazy. You're tired of jogging on the pavement, so you actually get to touch some grass. That is welcome news. That begins, I want to make sure I get this right, 5 o'clock in the morning on Saturday. But those parks, it's very important that you recognize that those rules, there are still limitations on what you can do. You can exercise only. So that's jogging, walking, running, things like that. You can't have a picnic. You can't use any playground equipment or any exercise equipment. And you can't play any sports because they want to limit any kind of contact. So that's really just for you to go in there, maybe with someone who's in your household, take a nice stroll through the park. The botanical gardens are going to start to open up as well. So you can get back and enjoy what we love about Hawaii, but do it, of course, social distancing. Unless you're exercising super hard, they still want you to wear a mask. So if you're just walking, keep a mask on.
That's right. So again, we'll begin to see some of those things being lifted as long as those social distancing efforts are put into place. There also is the announcement that more businesses will be allowed to open in before that 31st, that extended stay-at-home order. So we will see a few announcements maybe every week of new things that will be allowed. Car dealerships are one of them. Real estate companies could be another. We could eventually see some shops that will open up, but they will be limited to the amount of people that are allowed inside. So a little bit of the easing of sort of this order. We want to hear what you think. If you think this is a good idea, make sure you type in those comments as well. We also heard about more than $2 million being allocated for more than 10,000 tests that want to be conducted in the community. The mayor saying that in order to really get us back to the point where we sort of live a life of normalcy, there has to be more tests that go out there. So more funding going to go into providing these community health centers with more access to be able to provide those tests to become sort of a gauge of where we are at in the community and the overall community spread. And we're actually going to be talking to somebody who will be working maybe closely with that.
Yeah, Dr. David Derauf is going to join us now. He works with Kokua, Kalihi Valley. Of course, that is one of the community health centers that is in discussion to take part in these widespread testing. Thank you so much for being here, Doctor. We know that the video quality is not the best, but we are so interested in what you have to say. We are going to all collectively look past that this morning. So if you could just start off so that people have a sense of your perspective on this, can you tell us a little bit about Kokua, Kalihi Valley and the patient population that you serve?
Sure. Thank you so much for having me on the show this morning. Thanks for sharing that good news about decreased number of cases in the state. I think we all need to have some good news these days. It's been a stressful month. It feels more like it's been a stressful year. I don't know how everyone else feels about that, but time seems kind of both compressed and expanded at the same time. What I would like to say, Kokua Kalihi Valley is a community health center. We're really a center for community health that has been serving the Kalihi community since 1972. And it's interesting because our approach to how we work with our community has very much deeply informed our approach to how we have responded to this epidemic. And I'd like to talk just a little bit about that. Our central focus as an organization over the last 47 years has been one of building relationships. Our motto is neighbors being neighborly to neighbors. And we take that relationship building really seriously. And we're finding that to the extent that we have those relationships in place, both within our organization and without our organization, we've been able to respond much more effectively and more quickly to this COVID epidemic. The second thing we see ourselves as doing is that we have always seen ourselves as connecting our community to the care and resources that they need. And clearly in an epidemic like this, making those connections becomes much more difficult. People ordinarily can walk in or take the bus in or drive into our clinic and be seen within the four walls of the clinic. Obviously, in an epidemic, we don't want to encourage that kind of behavior. So we've been having to move the type of connections that we have to virtual ones like we're doing right here. 2 months ago, we couldn't have imagined, I think, doing this interview in this fashion. We would have been in a studio somewhere, and now here we are, each in our own offices, staying safe, but still communicating. That's no different than it is within the four walls of our clinic. We had to transition to telehealth in a really rapid period. I'm so proud of my staff who made that transition literally in less than 2 weeks. And it feels like we've been doing it for years. And many of my patients are now saying, hey, how come we didn't do this before? So that's been one of the pleasant surprises for us. The next thing we do in our community is we are part of growing a sustainable food system. And that includes a 100-acre nature park in the back of Kalihi Valley, Ho'oluaina, where we do grow organic food that we provide to the community. But our Roots program as well, that works with a variety of organic farmers around the state as a food hub that features local foods and foods that are indigenous to our community. And that food system is incredibly important right now as we're hearing more and more families don't have enough food to put on their table. So part of our effort is to bring food to the community. And we're doing that not just ourselves, but with a large network of other entities, Kamehameha Schools, the food bank, et cetera, who are all pitching in and helping to do what we all need to do to make sure our community doesn't go hungry. And food is not just about filling your stomach. Food is about those relationships and sustaining our soul, and also making our bodies strong so that we can fight this infection. And finally, our organization history is one of sharing information through storytelling, through surveys, through health education, and obviously getting the word out about how individuals and families can best tackle this COVID crisis has been an important part of our work. I'm really excited when I see patients come to the clinic with a mask on. I'm really excited when I see people understand that social distancing is not just something that's nice, it's really essential right now. But we all have work to do in that regard. We're not used to this. We're learning quickly, but maybe not quite quickly enough. One thing I'd like our listeners to think about is the economic impact of this shutdown is ginormous. I spoke to an economist at the University of Hawaii yesterday and asked him, what is this costing the state of Hawaii? The estimate it is per month we shut down is about a $2 billion or $3 billion investment. A $3 billion investment. So literally we are making the largest single investment on a monthly basis by far, probably an order of magnitude larger than any investment we've ever made in the history of Hawaii. So we've made that investment already. And now I think it's time for everyone to say, so how can we make that investment flourish? Because if we make that investment, which we've done, and then we're sort of half-hearted about all these other measures that we need to do, hand washing, social distancing, wearing masks, staying away from crowded places, being smart about this stuff, it would be an incredible wasteful thing to do, having already invested those billions of dollars. So I think we all need to redouble our efforts here. We shouldn't coast. We shouldn't look at the numbers and go, oh, we're through this, we're good. If we look around the world, we're going to see some really clear examples that I'd like to talk about this morning with people where they did that and they're paying the price now. That's been basically our approach. The one thing I would say is those are the things we always do: build relationships, connect with our community, grow food, share information through stories. Those are things we've done for 47 years. Now we have the added charge of keeping our community and our staff safe. And that's been a challenge. As you know, we haven't always had adequate supplies of personal protective equipment. We haven't known the drill. We're all learning this as we go. But I'm really proud to see how the community health centers in Hawaii and our community health center have risen to this challenge, are excited about the work that we're doing, come to work every day, ready to be healers and ready to connect with our community.
Well, let's get to that testing piece of this. What do you think of the testing that's gone on so far? And how do you think having those additional 10,000 tests networked through the community health center is going to change the picture of coronavirus in our community?
Yeah, it's I think the mantra that is developing around the world is one of test, trace, and quarantine or isolate. Two words that I don't like, and we can talk about that. But the first piece of that is you have to know where the illness is. And if you don't do testing, you won't know that. And I think Hawaii has done a pretty good job so far of getting tests out there. Many of them have been done in settings, however, where people need to be able to drive up to get a test. And if we think about that, who does that exclude? I think the first group that comes to mind is our kupuna, who by and large don't drive to a testing site. It may be that their family doesn't have a car and can't drive them to a testing site. They're at home alone. Everyone is helping them to shelter safely in place. We really wouldn't want them to go to a crowded testing site. And we know with this illness that the most at-risk group is our elders. And so that's the group we should be focused on. That includes people who are at home, aging in place, and it also includes people who are living in long-term care facilities. We know we need to be doing more testing there because if we look around the United States, we can see that there continue to be a significant number of hotspots popping up almost on a daily basis now in care facilities. And so I think one of the challenges for Hawaii right now is to figure out a suitable testing protocol, make sure that we can respond to things in a emergent fashion, not days later. This epidemics don't wait for you to respond that way. You have to be able to respond immediately. You have to be able to come in, do the tests. It's not just a matter of doing the test too. Up until recently, most of the tests that were done were being mailed to the mainland to be run. Oftentimes the turnaround time was a week before you get the result. That kind of delay in results is damaging to all of us. We really need to reduce the amount of time it takes to get a result back. I'm hearing now that there's an increasing availability on island with turnaround times as low as 24 hours. That's going to really help us to focus on those at-risk communities.
We know that you talked about the efforts that are being made with telehealth and the things that you folks are doing. So I guess one of the questions now is you physically, is your clinic open or closed, and what's sort of the plan for that? And also, we got a question here from Emilio. Can a recent immigrant be tested for COVID-19 at a community health center? And what about the insurance needs? So I know that you guys service a lot of people who maybe struggle with those types of things. What would your advice be for those people, and maybe in particular with what you folks are doing out there at your facility?
Yeah. Sure. So first of all, absolutely, we are open for business. We have 210 staff. They're all at work. Many of them are now working from home. Many of them are working in new roles for them. Dental care, for example, has been significantly impeded due to the high-risk nature of working with drills in the mouth and the aerosolization of the virus. So our dentists are finding really creative ways that they can use their skills and services for our community, as an example. But yes, we are open for business. The way we are open for business looks quite different. People oftentimes used to just walk in and wait to be seen. We now are, and I think most health entities strongly encourage everyone to first get on the phone, call in, and speak to someone before coming in, because oftentimes we can conduct that visit via computer if it's available, and if not, just over the telephone to figure out what's going on and what the best disposition for that person might be. Obviously, we're so focused on COVID that we forget that other illnesses like heart attacks and strokes haven't mysteriously disappeared. So in our great concern for this epidemic, we don't want to lose sight of the fact that people do need to take care of their chronic health conditions, or we'll really have a very large disaster on our hands. That means people need access to talking to their doctors. They need access to their medications. They need access to comforting words. Yes, the health centers serve a large uninsured population. That is the nature of our work. We don't discriminate on the services we provide to anyone based on whether they're insured or not. All services at health centers are provided on a sliding fee scale, meaning that if you're below poverty, typically you pay either a nominal fee or nothing at all. That would be true for testing as well. We haven't, mostly at our health center, we have been utilizing some of the local regional testing facilities set up at Queens Hospital and set up at the Kapiolani and Straub hospitals, as well as some of the pop-up centers that have been going on. The reason we did that is to preserve limited supplies of personal protective equipment, and because it really probably is best for people to be tested by someone who's really experienced doing the test. The worst thing, getting a test is not just a matter of a simple procedure. There is a right way to do it. And we want to make sure that our staff are fully trained in the best procedures on how to do that. And that's continually evolving, so that when you get a test result, you have some reason to believe that it's an accurate test. We've heard of some tests being conducted where, for example, I don't know if you've talked about this on any of your shows, but in order to conduct a good test, you really have to put a swab all the way back into your nasal passage. It's quite uncomfortable for people. It's the examiner, it oftentimes provokes a cough. So the person doing the test doesn't really want to do that. because they know they're going to get coughed on. So you really have to, the person doing the test has to have adequate personal protective equipment. The person taking the test has to be prepared that it's going to be a little bit uncomfortable, so that you can get an accurate result. So I just, I think we've been cautious about that. We've been wanting our patients to get tested in the best facility. Oftentimes that means getting people to those test sites. But increasingly now, as the supplies of PPE are opening up a little bit, and the supply of test kits is opening up a little bit, we will be doing more and more tests in our own facility and going out into the community to deliver those tests. That's the good news, and we're really appreciative and supportive of the mayor's efforts here to get test kits and needed supplies out into the community health centers, so that we can increase testing to our very vulnerable communities. Last thing I'd want to say about that is, and I think it's the most important point. If people remember one thing I say this morning, it's this: everyone's health and Hawaii's economy is connected to and contingent upon how we all support our most vulnerable communities. And why do I say that? If we look at Singapore, and hopefully people have been seeing the news about Singapore. 2 weeks ago, Singapore was being hailed as an example of a country that had completely nailed this thing. Despite considerable trade with China, they had very few infections, and they had the same number of deaths as Hawaii, despite a population of 6 million people. Their model was being hailed as the model to go after. And what happened? Well, they really let down their guard. They failed to reach out to their most vulnerable communities, who turned out to be low-income workers who were being housed in very crowded dormitories. And the infection took hold in those dormitories. And during the course of the last week, they've had 1,000 to 3,000 new infections a day in Singapore. It is a shot across the bow for all of us. We can't rest on our laurels here. We can't assume this thing will go away. We have to stay vigilant. We have to be focused on those communities who are most at risk for this. And that includes our public housing projects. That includes our vulnerable elderly. That includes our homeless population. If we don't do a good job with those communities, all of us are going to pay the price of this.
That is a wonderful message. At last question this morning, as individuals, what can we best do to support those populations?
I think the most important thing we can all do as individuals is to be smart about this thing, to keep on doing the things that we're now learning to do. Wash your hands. Wash your hands well. Put a mask on. Stay home. I am really highly appreciative. When I say stay home, I also think people do need to get out and get some sunlight and fresh air. Do so safely. Do it away from crowds of people. I'm delighted that the mayor is going to open up the parks again. People need to get out and be physically active, but it shouldn't be an opportunity for us to let our guard down and think we can gather in the park and have picnics and parties. We really do need to be smart and safe about this. That's the most important thing we can do, because if we're all doing our part to reduce the transmission of this illness, then eventually we will succeed. I think the other thing we can do is think about who out there maybe is having a hard time right now. As we know, a lot of people have lost their jobs. A lot of people don't have money in the bank to turn to. A lot of families don't have adequate food. A lot of people are lonely and at home right now. Think of a way that you can reach out to some of those people and offer to be of assistance. Maybe if you're doing a shopping run and there's an elderly neighbor, ask if you can buy food for them too. Maybe get on the phone with someone you haven't talked to in a while and give them some comforting words. Turn off the TV a little bit with all the bad news and look outside and reflect on what an amazing place it is that we live in Hawaii, where we are all just 1 or 2 degrees of separation from one another.
All right, great advice, and thank you again for giving us an update on the efforts that you folks are doing over there at your facility. And we really appreciate everything that you shared with us today, and continue to ask you to stay safe and do what you're doing for the community, because you're doing a great job. Thank you so much, Doctor.
Thank you.
Thank you.
Wonderful to hear from him. We apologize for the video quality there, but his message is so important that we really wanted to bring it to you. And Ryan, I thought, bringing up Singapore is a really, really good point, because he's right. They were hailed as the model for having kicked this thing, and now they're seeing that surge. And so that's a reminder to all of us that, yes, we saw 2 days in a row of 0 cases on Oahu, and we want to keep it that way. So keep doing what you're doing, as frustrating as it is. And that's why I think a lot of folks say, well, we're doing so well, why are we extending this by a month? That is exactly why, so that we can really nail this thing and have it go away so that we can get back to our way of life. We want to bring you some other headlines in today. 2 visitors arrested in Waikiki for violating the coronavirus self-quarantine. The governor did talk about perhaps creating a quarantine hotel or something. These folks, a woman and a man, one from Las Vegas, the other from Sydney, Australia, were arrested on Tuesday morning for violating those emergency rules. And it was all thanks to Instagram that they actually got caught.
Yeah, social media proving to be a way and a tool in which you can actually get into trouble for the things that you post. So they were able to use that and sort of track them down through Instagram, met them back. They were actually staying at the Lalo Hotel, and management there actually also reminded them. So they were warned a few times, but we're seeing more and more of this, especially on social media, with local residents actually posting visitors that they're seeing out in the community and recognizing that, hey, they're not from here. They're probably violating this order, and so putting them on blast, essentially putting them on social media. And with some of these large followings that some of these social media accounts get, it attracts a lot of attention, and in this case by law enforcement, and they were able to penalize these people for not following the order. And so we also know that we talked to the governor on Monday that the state is looking for efforts and ways to kind of close that loophole to make sure that they are finding ways to ensure that those who arrive back in Hawaii do really follow that 14-day quarantine.
Yeah, the other thing, social media allows us to see what folks are up to. And Senator Laura Thielen's Facebook post was very interesting. She's one of the folks who is volunteering at the convention center to help process the nearly 250,000 claims that have come in there. We invite you to go check out her Facebook page if you want to read this in detail. But basically, she's saying that if you're self-employed or an independent contractor and you filed a claim with the state, you're going to get a rejection letter. We faced a lot of these questions yesterday when we had Scott Murakami on. But that does not mean that you're not eligible for federal benefits, and that the state is still working to try to set up a system where you can apply for those federal benefits. We brought this to your attention because we both have gotten a lot of personal messages since yesterday asking about those independent contractors, 1099 workers, and what have you. So we invite you to go back and watch Scott Murakami's interview in depth, watch the full half hour, because he had a lot of good information there. Know that the state is working with the State Department of Taxation to try to figure out how they're going to actually create a system for those 1099 and independent contractors, what have you. And Allison Schaefer has a great piece in the paper about this today as well. And Scott's on next week.
That's right. We were able to get Director Murakami to confirm that he will be with us on every Tuesday. So it's sort of your unemployment Labor Tuesday questions. We can ask the director on Tuesdays moving forward through the rest of May. So, if we didn't get to your questions, we will get to them hopefully next Tuesday, if not the Tuesday after. We also will have the governor as well on next week, Monday as well, who is also committed to joining us for the next few Mondays as well. So a great opportunity to get connected with those leaders there. We, of course, always like to highlight a good news. We heard from just how important sharing good news is, and we have some amazing heroes in our community. One of them, of course, is a partner that has helped with so many things, including getting us from point A to point B. That's Hawaiian Airlines.
Yeah, Hawaiian Airlines is working with the nonprofit Everyone Hawaii that we've talked about at length on this show. They are the folks who are behind the effort to distribute masks to the community now that we're all required to wear masks when we engage in business. So a flight arrived on Hawaiian Airlines yesterday that brought 1.6 million face masks from China, thanks to Everyone Hawaii. They ordered the masks, and then those masks, not a single one of those 1.6 million is actually going to be sold. They're going to be distributed to the most vulnerable in our community, including the homeless, jobless, low-income families, what have you. So Everyone Hawaii paid for the operational costs, including the fuel and the landing fees, but the rest of that, including the crew and the plane, were provided by Hawaiian Airlines. So this is awesome to see, a business partner and a nonprofit working together to get people the resources they need. And we know so many folks need masks right now, especially because the grace period, if you will, for the mayor's mask order is over starting today. You can't get on a bus, you can't go in a store, you can't do any kind of business unless you have one on. So great to see that. Mahalo to Hawaiian Airlines and Everyone Hawaii.
Yeah, so thank you. They are our Hawaii heroes. Another organization that has really stepped up, of course, the Salvation Army. And they've actually, at the Kroc Center, they partnered with the Hawaii Food Bank to distribute food bags. So if you know anyone that is in need of food, we saw the long lines that happened just a few weeks ago when the Salvation Army was distributing food at Ala Moana Center. We want to encourage you. There's the information that you can get more information about those food bags that are being distributed. And then this is their emergency hotline, and you can email them for those that may be struggling, or if you know somebody in need. I encourage you to head on over there, send them an email, give them a call. But they're trying their best to provide, of course, food, which is a necessity for everybody. But for those who especially need it during this time, we know a lot of people out of work, not getting maybe their unemployment checks, so not able to go to the grocery stores to buy those groceries. So again, the food bank and the Kroc Center joining together for this effort.
Yeah, and Dr. Derauf also talked about how important it is to connect with people right now. And we want to highlight something that Coronavirus Hawaii is doing that you can take part in. And that, of course, is writing letters to Kupuna.
Yeah, so we want to encourage you to head on over to the website, coronavirushawaii.com, where you can actually send a digital letter that will be used, that will be sent to a machine that will actually handwrite it. Because it's always better to receive a handwritten letter than one that, you get through an email or a typed letter. So it's a machine that will actually handwrite your letter for you. There's a small fee that's involved for shipping, but you can do it that way, or you can send your letters directly. We've been getting a lot of letters from Keiki throughout the state who are sending letters to the kupuna to just encourage them, and want to encourage all of you to help and provide some inspiration for our elderly in this time. So again, coronavirushawaii.com.
Looking ahead to tomorrow, Hawaii State Senate President Ron Kochi is going to be here. We are going to be talking to him about the budget shortfall and any other questions you have about the state response. We're looking around $1.5 billion that the state has to figure out how to make up. There's been a lot of talk about cutting state salaries, salaries for state workers. That, of course, includes teachers and some first responders. So a lot of people had a lot of thoughts about that. So we're going to be asking him about what legislators are doing to try to figure out how to manage this budget, and also the state's response to the crisis overall. So bring your questions for him. We can't wait to see him tomorrow. And
then on Friday, it's sort of we're ending the week with Kauai. Of course, Senate presidents from Kauai. We then will speak on Friday to Derek Kawakami, the mayor of Kauai, to talk about the efforts that have been made there, sort of the things that they're seeing. Their case count has not gone up, I think, in about a week now. They've been pretty steady at 21. Trying to hear from him about some of the things that they might be looking to lift on the island of Kauai. We've also seen them sort of do things that the other mayors have followed. And so we want to hear from him and sort of the way in which he's leading that county. So we're excited to have the mayor joining us here on Friday. So a lot of things to look forward to, and want to thank you and, of course, our partners at the Hawaii Executive Collaborative for helping to bring this conversation to all of you and allowing us this opportunity to help you engage in this conversation and bring you the information that you need.
Yeah, so until tomorrow, stay safe, wear a mask, social distance, do all the things that you're doing, and we will continue this conversation tomorrow. Until then, have a great day.
Aloha.